Frozen Shoulder in Baseball Players by Justin Silva, UTRGV, Dr. U, Kinesiology-3352-01. Introduction. Frozen shoulder, also known as adhesive capsulitis, is a chronic condition characterized by stiffness, pain, and limited range of motion in the shoulder joint. It occurs when the capsule surrounding the glenohumeral joint becomes inflamed and thickened, leading to restricted movement. In baseball players, especially pitchers, repetitive overhead throwing motions can contribute to irritation and tightening of the joint capsule. This condition develops gradually and can significantly impact athletic performance. Classifications. It can also be classified into two main types. Primary adhesive capsulitis develops without a known cause, often related to systemic conditions or gradual onset. Secondary adhesive capsulitis occurs due to underlying factors such as repetitive overuse, previous injury, or prolonged immobilization. This type is more common in baseball players due to repeated overhead throwing. Additionally, frozen shoulder progresses through three clinical stages. The freezing stage, gradual onset of pain and decreasing range of motion. Frozen stage, stiffness with reduced pain but significant motion limitation. And thawing stage, gradual return of range of motion. Anatomical principles for safe performance. The shoulder joint relies on the balance between mobility and stability. Proper scapulohumeral rhythm is necessary for efficient movement during throwing. When the joint capsule tightens, it limits both active and passive range of motion, disrupting normal biomechanics and increasing stress on surrounding structures. Signs and symptoms. Common signs and symptoms include gradual onset of shoulder pain, stiffness, and significant decrease in range of motion. Both active and passive movements are limited, especially external rotation. Pain is often worse at night and during overhead activities. Athletes may also experience weakness due to reduced use of the shoulder. Mechanism of injury. Frozen shoulder typically develops gradually due to repetitive overuse rather than a single traumatic event. In baseball players, repeated overhead throwing, especially with improper mechanics or excessive pitch counts, can cause inflammation of the shoulder capsule. Common errors include poor warm-up, muscle imbalances, and inadequate recovery time. Epidemiology. Frozen shoulder is most common in adults between ages of 40 to 60, but can also occur in younger athletes due to overuse. It is less common than acute injuries in baseball, but is significant because of its long recovery time. Overhead athletes, particularly pitchers, are at risk due to repetitive stress on the shoulder joint. Factors such as previous injury, poor conditioning, and inadequate flexibility increase the likelihood of developing this condition. Rehabilitation. Phase 1. Pain and inflammation control. Focus on rest, activity modification, and gentle passive range of motion exercises. This goal is to reduce pain and prevent further stiffness. Phase 2. Restore mobility. Introducing stretching exercises and joint mobilization techniques to improve flexibility and gradually increase range of motion. Strengthening. Strengthen the rotator cuff and scapular stabilizers using resistance exercises. This helps restore stability and support proper movement patterns. And phase 4. Return to sport. Implement a gradual throwing program and correct any mechanical issues. Sport-specific drills are added to safely return the athlete to full performance. Conclusion. Frozen shoulder is a condition that can significantly affect baseball players by limiting mobility and causing pain. It is primarily caused by overuse and poor mechanics. Early detection, proper rehabilitation, and attention to throwing mechanics are essential for recovery. Maintaining flexibility and strength and proper workload management can help prevent this injury and improve overall performance. References: American Academy of Orthopedic Surgeons, Current Concepts in the Rehabilitation of the Overhead Throwing Athlete, and the role of the scapula in preventing shoulder injuries. This is my presentation on frozen shoulder in baseball players. Once again, I'm Justin Silva for Dr. U, UTRGV, Kinesiology 3352-01. Thank you very much.